SIU has always been known for its innovations in education. That's one of our big principles, is that we want to educate the new leaders in emergency medicine. Not only do we have a great patient population and great clinical sites here at the Memorial Center for Learning Innovations, we have a staff at which their expertise is in education, for which they're internationally known.
I think what sets us apart, one, is our somewhat drilled down focus as it's gone through its evolutions of being really focused on adult and pediatric resuscitation. And that's honestly at the heart of it as you go through cases and go through scenarios, kind of where the rubber meets the road. It's recognizing what you need to recognize, ordering what you need to order, intervening where you need to intervene. Anytime that we can make those decisions more efficient based upon what sometimes limited information we have, that's where I think the outcomes and outputs of really drilling down on the resuscitation piece makes them more efficient, more confident, more personal, and hopefully more successful physicians in this whole team environment, because it's not just the physician in the room, it's very much the epitome of a team sport.
One of the things that we've introduced about a couple years back is what's called our multidisciplinary curriculum, where we work with the nurses in our simulations in the lab. And these are the same nurses that you work at clinically in the emergency departments.
When we have a scenario, if there's a pharmacist in the room, it's a pharmacist. If there's a nurse in the room, it's a nurse. Techs are techs, paramedics are paramedics. We don't have to try and fit people into roles.
Our trauma room is a mirror image of the trauma room in the ED. A regular patient room is a mirror image. The Pyxis machine works, where you get the drugs. When a respiratory therapist comes to participate, the ventilator works. Everything works. In your mind, you just immerse yourself into that scenario, and it becomes very real, and you get the fight or flight response, and you get the sweat and the adrenaline during a case.
Just in general, in my nursing career, what I've seen is a stronger connection between the physician and the nurse. We've learned to really work better as a team. Because of that, our patient care is better, our patient outcomes are better.
I think there's a lot of the interpersonal skills that we have the opportunity to work on as well. Not only working directly with a lot of the staff we work with in the department, but it's interesting to get to see how your co-residents will also approach different problems, how kind of your co-residents approach how they interact with staff, and there's certainly things to be learned that we don't always get a chance to learn from one another that come out in the sim lab.
So we can ask the nurses, how did you feel when they asked you to do so-and-so? Or, did the paramedics feel listened to when they dropped the patient off and they were giving their EMS report? How did the techs feel? Were they asked to do things outside their scope? Were they asked to do too much? That's the other piece I think that comes with our collaborative approach, is making sure that the communications piece is the really important part. I think another piece for us is what we've affectionately termed our art of medicine curriculum. This hits home on some of those difficult topics that are somewhat outside the realm of just resuscitating patients. It could be delivering bad news. It could be talking to someone about a medical error. These are not necessarily the fun conversations or the happy part of, hey, I saved a life. Sometimes some of the conversations we have are difficult.
Some of the things that we thought we were doing that were, we thought was reassuring, to the person who was our patient actor that day, it wasn't interpreted the same way. And so there's an opportunity to learn some of those things that someone from a non-medical background doesn't interpret this as the same reassuring tone or reassuring tact that you were taking with them.
If we can do it in this environment where it's a little bit more safe and intellectually safe, having those difficult conversations and again drilling down on the communication piece is best for our learners, best for our patients, and best for those that we serve.